Hi everyone, my name is Adam, and today I just want to introduce you to dynamic neuromuscular stabilization, which is something that I learned when I was in school, introduced by a chiropractor, our team chiropractor, and he came in, he did a class on that, and I was very interested in the topic, in the concepts, and so it is a very big topic, and I bought a whole book like about this idea, and then but today we're just gonna focus on the breathing and core stabilization because these two are the most fundamental aspects of DNS. Hold on, are we good? Can you see the? Yeah, perfect. So here are my lesson objectives. So our outcomes. So I want I want us to be able to identify some structures about the core, right? And then maybe for us it's a reveal, but I think it's good to have some reveal and then to start on a solid basis, right? The second one is I that all of us can like identify different ways of like athletes stabilize their core. There are a way to like here's what I put optimal and suboptimal. It doesn't mean they're not strong, but it's just that the way they do they stabilize their core, it's not efficient, or it can lead to injuries or low back pain or chronic injuries, whatever. Right. The third one is my hope is that we can use some of these concepts like tomorrow into our clinical practice, into our rehab, into our exercise programming. Right. Yes. Okay. So the DNS is a concept developed by Dr. Kalaj. He's from Czech Republic, and he based this whole idea on following developmental kinesiology. And so the idea is that we follow the developmental stages of babies, like 3 months, and then all the way to up to a year. That's where they start to walk. So a little bit more like adults now. So I'll talk a little bit more about that in the next slide. But the idea is that we try to compare the difference between adults and the babies, and then see how our motor patterns, how messed up they are in real life, get kind of like tainted by just by like 20 years of living, or even more, right? So yes. So DNS has basic like largely it has three different principles. The first one is developmental kinesiology. Is there a way to say the word like correctly? Like that's yes. So if you see the picture on the left, right? So the baby is at 3 months position. So because when they start, they don't have a good core stabilization. We're gonna get to at our later, but so they're either on their stomach or back, right? So and then the clinician uh puts the patient into different positions, and that's the starting point, and then the clinician introduces the breathing, and then core stabilization, and then followed by different exercises with different resistance. The second principle is joint centration. It means that a centrated joint means the joint is at its most uh, congruent position, right? Which in which it can transmit forces the most efficiently and the most stable position. It's like our closed back position. And on the picture, in the picture on the left, so the hip is in the centrated position, which is abduction and external rotation. So the clinician would actually place the hip into that position and have the patient do exercises. And the third one is our topic today, the core stabilization, right? Because everything starts with the core. Because imagine if you try to move your arm, you would have to have a stable base, right? Through your scapula, and then scapula connects to the torso, right? That's why core stabilization is a fundamental aspect of DNS. Okay, so yeah, let's talk about the core. So we've been learning about the core since years, right? We talk about core, and different people have different ideas of the core. So I want all of you to just scan the QR code, and it will go to a survey, and then I want to see the answers that we have, and then we can go from there. I would actually have to. Oh, okay. And then so you can put either muscles or bones or ligaments, like anything that comes to mind. I think that's fine.
Adam, it's still loading for me, so give me a second.
Oh, no worries. I hope we have enough time, but let me refresh. Oh, yeah. So, wow. I did not anticipate these many answers, but I think it's awesome, right? So I'm seeing a lot of muscles, and I'm also seeing lumbar-pelvic hip complex. I think that's awesome because, and then like good, good. I think mostly we focus on a lot on the muscles, right? And then a lot of like abs, right? So internal oblique, external oblique, and then and TA, right? Good. Let me get back to the presentation. Present. Can you see the screen?
Yes, we can.
Nice. All right. Okay. Well, here's just like answers for the muscles, right? But you can also see we have the diaphragm, right? We have the pelvic floor, and then followed by we have the spine, right? The lumbar spine. And what we are now seeing is the hip joints, right? The SI joints. We're seeing the SI joints, and also we're missing some of the fascia, right? Like the thoracolumbar fascia, right? So I think so that means everything is connected, and I think it means that there's a lot of different aspects, a lot of different structures that can affect core stabilization, right? And then so today I want to focus on the diaphragm, which is the driver of core stabilization according to DNS. Okay. So according to DNS principles, we have our diaphragm has two different functions, right? The first one obviously is breathing, right? I always say that to my patient: first, you don't breathe, you die, right? And then I think GIF, this GIF here, it's a very good illustration of how the diaphragm works and how wrong it is in terms of core activation, because when we breathe in, the diaphragm contracts, and the dome of the diaphragm goes inferiorly and compresses our abdomen, right? But in this GIF here, the intra abdominal pressure is the same because you are doing the person is doing the belly breathing right now, which means you are not really increasing the pressure in your abdomen, right? Because the the space in your abdomen is the same. It's just like the shape changes, right? That's why the pressure is the same, right? And that's why the reason why some people are against belly breathing, because you're not stabilizing anything. You're just working your diaphragm really hard, right? And then the second function of diaphragm is core activation. So in order to achieve this, the diaphragm down inferiorly, it compresses the abdominal content, and then we have all other muscles in our abs, our obliques, and our transverse abdominis, right? Our pelvic floor. So the way I describe this to my patient is, imagine you are a barrel, right? The pressure in your abdomen when you really stabilize your core is it goes 360 degrees, go to different different directions. It's not just like anterior, posterior, or side to side. Like it has to go in like 360 degrees, right? And then it doesn't really expand this much, as you can see on the left, because when you breathe in, the pressure builds up, and your obliques needs to expand, and then they contract. They contract eccentrically and then isometrically, trying to make a confined space. That's how you increase the pressure, because if you were a balloon, right, you don't have pressure, right? Right. So I think that's the idea of like how we activate our core, by first activating our diaphragm, and then engage our obliques or our like TA to constrain the pressure, right? To illustrate this, what I want you to do is to first take a very deep breath, and then breathe out completely and hold your breath there. And then try to expand your abdomen, right? So here you just did the two different functions in two different steps. First, you breathe in and you breathe out, right? And then you try to contract your abdomen, right? You were still using your diaphragm, but not to its fullest, right? So in an ideal situation, you are doing both at the same time. Does that make sense? Yes.
Yes, but it makes sense. But is this why when your core isn't super strong, you can't breathe and contract your TA at the same time?
Yes. So I'm gonna talk a little about like what are some signs of suboptimal core stabilization strategy, right? If you are doing a like bicep curls, a 10-pound bicep curl, and you are holding your breath, that doesn't really make sense, because the task is not heavy enough for you to stabilize your core in that way, right? If you're doing a 300-pound like deadlift, like Warren, right? He does in the gym, right? And it's okay to do Valsalva, right? Because it's very heavy, right? So you don't do that with a 25-pound, and for athletes, right? Like, we're not talking about like the elder population, whatever, but there's like a ratio here. The strategy must match the task, right? Good. Okay, let's move on. So one of the ways of assessing breathing is by looking at the rib cage, right? So, but we're online right now, so we're not having a lab session, but it's best to be doing this in a lab session. But I'm just gonna talk a little bit about the rib cage. So ideally, right, according to Dr. Collage, they call it the physiological pattern, right? So when we breathe in, and the diaphragm goes down, compressing the abdomen, right? The rib cage should be expanding laterally, and then anterior posteriorly, right? That's how you increase the your lung cavity, right? To have the negative pressure, and then you have air in your lung, right? And so what is a not good way to breathe, right? So if we go to the next slide, we can see. So we have abdominal breathing, right? but so I think it's also belly breathing, but we already know that it's not the best way to stabilize your core. We also have thoracic breathing, which means you're breathing very heavily using your accessory muscles. So what are some accessory muscles? We have scalenes, right? We have sternocleidomastoid. I've never really said that word out loud, but we have our upper traps, right? And then our internal external costal, intercostals, right? And then these are the muscles that they don't have to work. If we're doing this right now, none of us are breathing with our accessory muscles. Hopefully we're not using those muscles, but so, but if we're running like marathon, it's okay to use those muscles because we need them, right? But that again, it's the strategy must match the task, right? So the way I assess the breathing pattern is by looking at the sternum, the rib cage. So I would have the patient lie down on the floor, right? That is not hard, right? The patient should be able to close to the abdominal breathing, right? So the rib cage should not be going up and right, and we should not be seeing a lot of activation of upper trap or scalenes or SCM, right? So that's how I assess breathing just by looking at the patient, right? So now we know how we should breathe. Let's go down to we're gonna talk a little bit about the strategies, right? This is a classic way to do core exercises. So what are some core exercises that we have seen that just like awfully done in the gym, right? Can someone give me an example, like anything?
Crunches.
The crunches?
Crunches. They use
Yes.
them.
Plank, plank, plank.
Oh yeah. So in our gym we have the core like a routine, right? They do like a dead bug, like a penguin or whatever, that lemon squeezes, whatever, right? So I'm just gonna pick on that bug right now because it pisses me off sometimes, right? If you look at this GIF here, first thing is the guy's head is not on the floor, right? So that's the first sign of, hey, maybe you're not really using your core. You're just squeezing your six pack, right? And they would often say that I feel more in my core, but you're actually just activating your six pack, your rectus abdominis instead of your TA, your internal oblique, that kind of musculature, right? What's another sign is their low back is not touching the floor. That's why they lift their head up, that you have more tension in the posterior chain to help you touch the floor with your lower back, right? Because that's what people say, keep your lower back on the floor, but they can't. So they lift their head up so that they have more tension to achieve the goal. So athletes are more goal oriented, right? So if you want them to achieve a certain goal, they'll do it, but they don't care about the strategy, right? And then I'm sure this guy he's also holding his breath, right? Again, ideally, we want the diaphragm to be able to do the two functions at the same time, right? Because say if you're doing that back for 2 minutes, you're gonna pass out if you don't breathe, right? But if you hold your breath, if you start breathing for this guy, you're gonna lose the core stability, right? So that's the direction DNS is trying to like help us to go that direction, because to use our diaphragm and achieve core stabilization, right? Okay, so I've been talking a lot and right now. So the DNS principle, they don't have certain exercises. They have they do have exercises in different stages to mimic the babies, whatever, right? But it has to be done in every position that in our daily activities. It makes sense, right? You cannot just do this doing deadlifts, right? We have to be doing this right now. So we're doing this right now. So the way I do this, I'm gonna put my hand, this part, my waist. So my fingers are gonna, I usually place my fingers, the four fingers, medial to the ASIS, and then my thumb gonna be like in the posterior lateral trunk, right? So first, I want you to breathe in, and then I want you to push against your hands, like this part. So you're pushing outside and a little bit more anteriorly with your forefingers and posteriorly with your thumbs, right? Are you guys doing that? Yes. And then, so
Yeah,
that's the
geez.
first step. That's how you compress the abdomen to increase the pressure, the first step, right? The hard part is the second step. When you breathe out, I want you to maintain the pressure against your hands, but still you need to breathe out, right? Because remember when we learn how to lift, right? So right, we wanna like when we do a squat. So when we breathe in, we go down. When we breathe out, we go up, right? But how are you gonna stabilize your core when you breathe out and while doing a squat, right? That's how you stabilize your core. You need to be able to expand when you breathe in and maintain the pressure when you breathe out. That's how I think that is the core activation from DNS principle. And you got to be able to do this in every position. I do this when I was driving to Arizona, right? We have a sport, and I try to just sitting. It's very basic, right? It doesn't matter what your population is, right? I mean, for like 80-year-old, right? For my age, right? It's the same, right? So for a kid, so and I'm not gonna go into that, but it works the same way, right? And then we can start talking about how we're going to do this for our athletes or playing sports. If you're not able to do this on the floor in a supine position, then let's not talk about like just playing sports, right? I'm not saying they're bad athletes. I'm just saying the strategy they're using to stabilize your core is not optimal, right? Okay, so I believe this is the end of my lesson. I probably went over time, so well, it is what it is. But here's my assessment and core evaluation. I'm gonna have to open that up. Just give me a second. Let me go back. Oh, that's me later. So now you can just provide me some feedback, and I think we can stop. Are we gonna stop or?